Thank you for joining us for this episode of Leading by Example, an informational video series where subject matter experts from Spectrum Healthcare Partners and Spectrum Management Services Company provide guidance and other resources to help patients, providers, and communities on timely healthcare topics. Healthcare organizations are being stressed by the COVID-19 pandemic in a variety of ways. Hospitals and health systems are dealing with an overwhelming volume of patients, or ramping up to do so. Smaller hospitals and independent physician practices have unique challenges as they try to determine the best way to continue serving their patients and communities. Others are seeing dramatic reductions in patient volumes and struggling with how to effectively maintain business operations in this turbulent and uncertain time. In today's segment, Dr. Herbert Cushing, Chief Medical Officer at Spectrum Healthcare Partners, will share information to help answer common questions from healthcare organizations. Dr. Cushing is an infectious disease and travel medicine specialist who has guided healthcare systems across the U.S. through many epidemics and disease outbreaks, including H1N1, SARS, and anthrax.
I'm Dr. Herb Cushing, Chief Medical Officer at Spectrum Healthcare Partners and infectious disease specialist. I look forward to answering questions from healthcare provider organizations today. Independent medical practices, and especially ones that have ambulatory surgery centers, should strive to remain open during this very difficult time in America's healthcare industry. There's a role that you can fill by continuing to provide essential care to patients that need us now more than ever. The acute care hospitals will bear the brunt of the COVID epidemic, and they'll be very busy in this time. But there'll be many patients that continue to need health care that don't need to go to the acute care hospitals and can be safely seen in an outpatient setting like an independent multi-specialty physician organization or an independent organization that runs an ambulatory surgery center. Those entities can be kept open safely by screening patients at the door, making sure that there are staff who are healthy, who can provide care for them, and by providing the right personal protective equipment, sometimes to patients and always to staff to help safely take care of patients. We serve an essential role in this critical time in America's history. Healthcare organizations need to focus intensely on keeping their patients and staff safe during an epidemic like the COVID epidemic. There are key ways that you can do this. First of all, make sure that your staff are well trained in how to wear personal protective equipment and why they need to wear it, what situations they need to wear it in. Make sure that they do drills, practice patients coming into them. Make sure that patients can be safely and successfully screened at the door before entry into your facility to make sure that they're not ill, so that you can then let them enter and staff can provide care without feeling unsure that the patient might give them COVID. At Spectrum Healthcare Partners, we're doing a number of steps to make sure that we can provide safe care during the COVID epidemic. We started a task force structured under the incident command structure developed by Homeland Security that makes sure that we have daily communication between the organization and to external entities and with external entities so that we understand exactly what's happening in the communities that we serve. This task force also serves as a way for us to communicate internally through messaging, both by email and by text mail to the important folks at the front lines taking care of patients. A task force under the incident command structure that will help respond to an emergency, an example of which that Spectrum Healthcare is using, has key folks on it. There's a communications chief. There's always a leader who's designated to serve for a period at a time. For example, in Spectrum, we're having one person do this 1 week at a time. There are other key roles that are filled in. There's an operations chief and a finance chief to make sure that there's money to afford all the measures that you need to do to respond to the outbreak. During infectious disease crises, it's important to listen to people who are trained and are experts in the field of infectious and communicable diseases. That's a particular subspecialty in internal medicine, and there are several thousand of those doctors trained in the country. There are also experts in public health, and they are people that are trained to respond to epidemics, make sure that the public's health is ensured, and you'll also often find those folks employed at the county level or the state level. The state of Maine has many resources to help address these situations with an office through the CDC at the state of Maine. And there may be local infectious disease providers that can help guide you if you need guidance about what to do to respond, to make sure that your employees and staff have the right personal protective equipment and that you're protected and prepared to deal with the situation. Again, I'm Dr. Herb Cushing. We may have resources here at Spectrum Healthcare Partners that might help you or your organization, so please don't hesitate to contact us if you'd like our help.